Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about the importance of sleep. You know, sleep is a salient behavior of all mammals, and most mammals require a lot of sleep, more than 8 hours. If you look at all animals, they go to bed at sundown and they get up at sunrise. So, depending on what time of year that is, that can be anywhere from eight to, excuse me, 8 to 12 hours a day or a night. So that's quite a bit of sleep. And, the sleep is a super important phenomenon in getting you well. And the reason is several fold. First of all, sleep is the silent nurse. So a lot of healing, cellular healing, takes place during sleep. And that's because you're not digesting, you're not moving, you're not thinking, you're not expending energy in other places. Your body is quiet and still, and it can heal. The other thing that happens during sleep is something called glymphatics, Glymphatics. And glymphatics is a process, a physiological process, where the brain actually drains at night. And it does so to remove toxins out of the brain. And glymphatics occurs during deep sleep. That's why having deep sleep is really important when you're trying to heal from tick-borne illness, especially if you have neuroborreliosis or neurobartonellosis. You need to really be sleeping soundly and well in order to activate glymphatics and get that restorative sleep that your body needs in order to heal from these infections. So sleep is one of the first things that's disrupted in tick-borne illness. And a lot of patients will report that they feel wired but tired, or they have outright insomnia, which is a huge problem. And you have to rectify that first and foremost, because sleep is, again, the silent nurse, and you have to be sleeping well. So one of the things that we would check is progesterone, because women oftentimes have low progesterone, and low progesterone can lend itself to insomnia. There's a couple of other nutrients that will help with sleep. One is melatonin. Melatonin is a very potent antioxidant, and it is very neuroprotective. I take 30 milligrams a night, and I have for 20 years. Another one is magnesium, and you can use magnesium threonate or magnesium glycinate. I would say 400 to 800 milligrams at night should help you sleep. Another one is called Honokiol, Honokiol, and that's magnolia bark. And that's also really helpful to get you to go to sleep. Another one is 5-HTP, which is tryptophan, which is an amino acid, and that will also help you get to sleep. Some patients require medications like Lunesta, Ambien, Trazadone, Hydroxyzine, or Doxepin. And so it just depends on what cocktail works best for you. So the idea is to get preferably 9 or more hours a night of restful sleep. Obviously, that whole time you're not going to be in REM, but restful sleep, and so that you can wake up feeling really energized, charged, and ready to go. So sleep is the silent nurse. Everyone needs to be doing it a lot, especially in the wintertime. The body goes into the hibernatory mode just because the days are short. And so, getting enough sleep is super important to maintaining and returning back to good health. So I hope you found this information useful. I hope you have a wonderful day. Take care.